Hey guys, welcome to another EMG Talk About. I'm Damien Navarro, one of the managing partners here at the agency, and I'm joined here by Elliot Darvik. He's actually one of our brightest minds in digital marketing. Welcome.
Hey, appreciate it. Happy to be here.
Absolutely. Yeah, we're really excited actually because Elliot just got to go to a really dynamic conference in New York City. It actually was called, it's a little bit of a tongue twister, Business Development Institute's Mobile Healthcare Communications Conference. And especially when it comes to new technologies in the healthcare market, EMG is, of course, very, very excited to learn more about how mobile is really not only positioning itself, but being utilized by so many different types of not only healthcare institutions, but it sounds like pharmaceuticals, biomedicals, all over the board.
It's a full spectrum.
Yeah. And so I think that's going to be one of the really interesting things that we can probably chat about that hopefully you guys will find interesting as well, is just exactly how that particular industry is using mobile. Obviously, EMG serves a lot of different types of clients, from entertainment to some of the more non-traditionals or nonprofits. And it's always very exciting to see how each of them is utilizing something like mobile, or in the case of really last year, social became probably the darling of the media industry in very different ways. So with that, maybe we can open it up with a statistic that, thank you Bryce, by the way, who's behind the camera. Hey, Bryce, I swear you're going to see him in front of the camera here again soon, guys. According to mobilehealthnews.com, $233 million was invested in mobile health startups in 2010. I'd be really interested to see how that relates to mobile health startups in 2009, because I'm sure you're going to see a pretty much stronger exponential growth within that particular market. So with that, why do you think mobile is seeing such a huge play in the healthcare space? I mean, it seems like there would be a lot of sensitivities that would have to be looked through before something with that type of accessibility could be brought into the hands, not even the homes now, of many consumers.
Yeah, within healthcare, I think there's so many different touch points where you have, the insertion of a mobile device. So whether it's, now, I think the statistics that was shared at the conference was 78% of physicians have a smartphone, right? And so they have applications, reference applications on their smartphone that's, putting, like an Hippocrates application where they're looking at, and that's affecting the healthcare that they're giving to you. So whether it's that touch point in terms of, the relationship between a patient and a physician, or just how I'm finding information, right? When we're going to look up, our own questions. I'm not feeling well today, right? I have a mobile phone, I'm going to do a search. So that's just more and more becoming the touch point for access for information and communication. So it's a logical extension that you would find that in healthcare.
Well, and I remember even as recent as a couple of years ago, one of the most used uses for search was to self-diagnose. Mm-hmm. And so I know you had like WebMD and some of the major conglomerates that came around to provide that type of knowledge to the consumers, knowing that they were seeking that on themselves. How has that now translated into the mobile world? I mean, now you're just seeing that more and more consumers are just skipping, obviously, the desktop and going straight to their mobile devices. Sure. In order to investigate what they might have, what they might have heard. And I think you had a really interesting case study that we had discussed earlier around just the simplified use of SMS texting in a specific case study. Can you elaborate just on, maybe at the most basic terms, how something like mobile devices are being used to reach consumers in different ways?
Yeah, this is a really interesting case study that was shared at the conference from Mount Sinai in New York, where they created this program called Text in the City, right? A play on Sex in the City. But the whole application was about, it was connecting physicians and people working at the clinic to adolescents in the community that had questions about sexual health. And so the platform basically allowed them to anonymously send a text message to the physicians, any question they had, and have the physicians respond within 24 hours. And so it was just taking, it was creating a new connection between the physicians in this clinic and their constituents, these adolescents, through SMS text messaging. And it was just a very basic, kind of implementation of a mobile technology, but highly effective.
Now, you talk a lot about connectivity. I think that's an interesting term, because connectivity typically really translates into things like social and community. How much or how integrated is social with mobile initiatives? How closely should it be? Should it always be ingrained with one another? Do you have some thoughts? Because I know there was some things that you had observed on this kind of close tie between the two that maybe necessarily wouldn't always be the case.
Well, it was interesting. It was a persistent theme of the conference, where someone said that the question was asked around what kind of integration is there between your efforts in the social space and social networking and your mobile efforts? And the response given back was that mobile and social always go hand in hand. And that kind of statement persisted throughout the day, and I wished we'd questioned it a bit more, or at least talked about it more. I mean, on one hand, a mobile device is inherently social, right? We use it to make phone calls and texts, But when we talk about applications, I don't know that the two should always be tied. If it's just a reference application, do I really need a tie back to a social network? You know, and health is such an issue of privacy. Should we always be introducing you know, a social element to it?
Right.
I don't. I think, you know, just kind of you know, point blank, make it, you know, saying like a blanket rule, these two always go hand in hand is not true. Now, can they be enhanced? I mean, I can think of plenty of situations where I would want to integrate my social network maybe into a health application. Like, for instance, maybe there's, you know, I have a pill that I have to take every day. Maybe it's getting my buddy Damien, you know, he gets a reminder if I haven't taken it that day, and he sends me a text message like, "Have you taken your pill today?" You know, or a mother's son, right? You know,
it's almost
so
influencer based, but not necessarily like strong communal.
yeah, it could, or it could be some friends. Like I can think of times when it would make sense to integrate the two. And I guess the point, you know, I just walked away wishing we had talked about it a little more and not just taken it as a given. Like, yes, these two have to go together.
Well, well, and I think that's also to the point too. Is it's going to be complex. I mean, we talk a lot about whenever we're starting any type of campaign or any type of initiative, going back to what is the business need. If the business need is to reach, you know, individual consumers and have the most valued exchange of information with that particular consumer, and you're really not looking to tie your service back to, right, we talk about selling it sideways, that we're really not trying to sell it to a larger community or to within their community, that's going to be a very different approach than you would take of something that you're hoping to go viral.
Sure.
And that you're hoping to be shared.
Yeah.
How does the community influence play from a promotional aspect in getting the word out on these mobile campaigns? I mean, is it something that it's purely more data driven? Are they relying on advertising of any kind of means? Is it search? How are people finding these types of ads, or is it simply word of mouth?
No, it's actually a really interesting point that was brought up at the conference. Someone made the point that take whatever, you know, it was within the context of mobile applications, but they were saying whatever you're investing in terms of dollars into your mobile application, the development of it, invest that much into the activation, into the promotion, you know, getting people to actually use it. And it might sound kind of obvious, but whenever we think about doing mobile development, develop mobile applications, we're very, you know, you don't want to concentrate too much just on the cost of it. You want to look at the larger picture. What's my integrated approach? How am I going to get this into the hands? So it could be, you know, buying media that's more focused on people doing mobile searches and linking them to your experience or your application, but it's, you have to consider both sides of those pictures. And I think that's, I mean, you know, we do that with, you know, anything we build here at EMG, right? Some of our campaigns, whether it's in the mobile space or not. If we're building, you know, a landing page, how are we getting people there, right? We spent X dollars to build this, you know, cool application. You know, how are we going to get people using it? So it's no different in the mobile space.
What was one of the most compelling campaigns that you think you saw or heard just an incredible story about?
The one I mentioned earlier, the Text in the City, I thought that was really interesting. And Pfizer actually gave a really interesting example, or they talked about a partnership that they'd struck, where Epocrates, which is the #1, I believe it's the #1 health reference app for physicians and med students, look up you know, about drugs or you know, reactions, all that type of thing. And so Pfizer partnered with them so that under, I believe it was under each, you know, anytime you looked up a Pfizer drug, there could be a click to call button right there to put you in touch with a Pfizer rep that could give you more information or answer any questions about that particular drug. And what I thought was interesting was Pfizer could have created their own mobile application that acted as some type of reference guide, or could have been a reference guide on all their medications, right? But they said, you know what? Epocrates already has this massive audience out there. They already have thousands and thousands of physicians, the audience we're looking to target, using their, you know, their application. Why don't we just strike a strategic partnership? And so I thought I thought that was brilliant. You know, I mean, maybe it's simple, but it's just like, we're not going to put the development dollars into building our application. We're going to put those dollars into forming a partnership. And so I thought that was, and that was a theme throughout the day, where we saw different, there was a lot, you know, the theme of partnership. Roche was another one there, that instead of building their own, they do a lot of diagnostics, you know, in the realm of diabetes. Instead of building their own application for diabetes, they partnered with Glucose Buddy, which is the #1 app for those with diabetes and testing, you know, tracking blood sugar. So that was a theme throughout the day, and we do that a lot here at EMG, where, you know, we you know, the mantra we use a lot is, you know, an agency sans ego, right? And that means that, you know, if we need to bring another partner in that can do something better than us or that offers something different, like, we're going to do that. So and that's really, you know, it seems like a successful strategy in the mobile space as well.
Especially when you have so many, I don't know, I guess choices that you can do when trying to get this type of thing off the ground,
Sure.
you're going to want to probably experiment and look for partnerships at first, because that's going to allow you to really experiment with the campaign and the performance of it
Yeah.
before you jump deep down into doing it yourself.
That's exactly it, and that was one of the, and what can you learn from that?
Right.
Like Roche, they're getting de-identified data from the Glucose Buddy app. So they're actually learning about all the diabetics and how they use this mobile application. For them, this could, maybe they don't even look at this as a marketing investment, right? They might look at it, research and development. We're getting all this de-identified data back from the application on like our core, our target user, like the people who buy our products. That's amazing, and it's possible Pfizer gets something similar. I mean, I'm sure that the type of data Hippocrates has about physicians looking up different drugs, and so it's not just about the marketing, but also what data are you getting back. I mentioned to you before about the Text in the City program, right? So all these questions were being sent in from these adolescents and teenagers in the community to the clinic. Well, the clinic at the end of their trial period for this program then looked and categorized each one of those questions, and they were able to say, what, there's the biggest hole, we're getting the most questions about how to use contraception. There's probably a deficit of information out there for our constituents to learn more about this. Let's now tailor our marketing campaigns towards raising awareness about how to use contraception. And so it's
so funny because it's so different than the approach that we typically have taken with surveying and focus groups, which almost is a reactive type of investigative,
you got it.
Investigative tactic, where now it's like actual behavior.
Yep.
That's really cool. Now, it sounds like you've given examples of both kind of a B2B model as well as B2C.
Yep.
Is there something that's a little bit more prolific in the direction that many institutions or organizations like this are taking? I know pharmaceuticals is a good example that they do have two very different audiences, the actual physician side and the actual consumer side. Is there any kind of traction that you're seeing on one side or the other, or do you think that there's just opportunities on both sides for any businesses to really investigate where they might be heading?
Yeah, I think you're going to have to take a different approach for both, obviously, and it seems, for physicians, specifically physicians, they really want more reference applications, things that just help them do their job better and aren't going to, it didn't seem like one of the things that was like management of patient records or managing patients wasn't really something they wanted to use their mobile devices for. They wanted more kind of reference type applications, things that were just going to make their job easier, dosage calculators. Manhattan Research shared a lot of details on that at the conference. And for consumers, things that it's similar. What's going to provide me value? What's going to make my day better? So maybe it's not so different. Maybe it's about creating value on either side.
So what would you tell one of our healthcare clients if they were considering trying a mobile initiative? Where's a good place to start? I mean, where is it at the ideation process? Is it looking at their marketplace as a whole and say where are their gaps? What are some of the questions you would be asking?
I think the same questions we ask them anytime we start a project, right? Where are your pain points? What are your challenges? What are you trying to accomplish? And then let's figure out what technology best accomplishes that. Maybe it's SMS, maybe it's building a better mobile website experience. Let's dig into your data.
Right.
Do you really need a mobile, web page, right? Let's look at your Omniture data. That's something, so Pfizer, to give you an example, they saw that last year their traffic from mobile phones to Pfizer.com quadrupled.
Wow.
Right? So they said, all right, probably time to invest in mobile web experience, right? And they launched it the day of the conference, right? But they used the data first. They said, you know what, there's a need here. So it's the same thing we do during discovery with any one of our clients for any type of project.
Gotcha. Very cool.
Yeah.
Well, thanks so much, man. I mean, that sounds like it was really, really interesting. I'm sure we'll be hearing more about mobile initiatives in healthcare. I know EMG is very, very excited about the next year and some of the things that we're seeing from a technology stance that we're really going to be exploring and integrating directly into some of our clients' projects.
Let's do it.
Yeah, absolutely. All right, guys, thanks again, and we'll talk to you guys soon. Take care.